Okay, our elementary school children are our kids aged 6 to 10 years. Physically, girls tend to be larger than boys at this point. Muscles are going to continue developing, and they need regular exercise at this point, so a good way to get this is to go outside and play, as we talked about earlier in class today. Bones, okay, are going to continue to solidify, so they need a lot of calcium. They're going to start to lose their baby teeth here. They'll get their permanent teeth. And at about the age of 9 or 10, so the very end of this sort of elementary school childhood component, they will start to develop their reproductive system. And then we will talk about that with the next age group. Intellectually, their attention span starts to increase. So about 5 years old, you're looking at about 15-ish minutes or so. When you start to talk about these older elementary school to middle school kids, it can go up to about an hour, hour and a half or so at a time. They're better able to separate fantasy from reality, so they realize that movies, their favorite TV characters are actually not real. And they start to develop a sense of right or wrong, and they like to be very talkative at this age. Emotionally, okay, when we start getting, especially towards the 10-year-olds, their peers or their friends start to have a greater influence on their family, but they tend to still be very gender related, so they tend to the boys stick with the boys and the girls stick with the girls. They're very sensitive to criticism. Again, if you have a lot of peer influence, you tend to want to be just like your peers, and so they don't want to be considered anything other than what all of their friends are. Socially, some things they recommend is to avoid overwhelming the child, so maybe not scheduling too many activities outside of the house, although some are perfectly fine. Outdoor activities, right, again, that comes down to physical activity, play, and all of those things. And again, parents should just be concerned about making sure that they're teaching appropriate behaviors, okay, for how they behave in society. Some of the aspects of care that you have to consider are the structure and the schedule. So again, don't overschedule, okay, these children. Monitor the physical activities. While they can do a lot of this on their own, parents should be there to make sure that they're doing this in a safe manner. Again, just like the last age group, be more consistent with your activities, your discipline. So this is where parents can take a much more active role in setting the schedule. And certainly by this age group, because we are getting our permanent teeth in, you should definitely be seeking regular dental checkups and regular health checkups. And the timing of those health checkups will come up in our next video. Our next age group is 11 to 13, and these are called our middle school children. This is where puberty starts to onset. So the average age for girls is 12 to 13, although we talked in the reproductive chapter can happen as early as 9, as late as 16. And boys start to tend to have their growth spurts and bodily changes about the age of 14. You're going to see an increase in skin problems and acne, and because, again, they're very peer influenced and very self-conscious, this may be something that they're extremely concerned about. Intellectually, grades can start to slip. They start to be able to exaggerate, okay, tell less truths as the younger children do. And grades often slip not just because they're not as intellectual, but because they often want to and focus more on their friends or their peers, and that's not often seen as cool or popular. Emotionally, they want more independence, okay, so to do things by themselves, to make some of their own decisions. They may be discovering their sexuality during this time frame. So while this is young for some students, it is not for other children. So do keep in mind that we should be addressing, even to children this young, sexual behaviors. They may be temperamental, which really just means that they have a lot of mood swings. So they might be anywhere from happy to upset at any given time. And they tend to take on the behaviors of their peers. And, if you think back to, popular styles, popular clothes, hair, things we watched on television, you tend to do the same stuff that other people your age do. Socially, they're building other relationships besides just the family. These might be Friendships, they may be romantic relationships, and they often feel like they need a trusted adult to talk to because even if they have good parents, sometimes they feel that their parents won't understand or they just don't trust themselves to share that information. For aspects of care, again, provide assurance to the child. Again, they don't like to be criticized, so don't be hypercritical. Again, consistent discipline is really big here. This is a good place for parents to start to monitor friendships and the people that their son or daughter is hanging out with. Generally, since they do follow peer behavior, um, that is something that we do become concerned with. And again, just like our last age group, do not overschedule the child's time. That can become overwhelming for them and lead to some decline in other areas. Our adolescents, are officially from the age of 14 to the age of 19. So physically in this age group, we are centered on sexual change, and habit forming. So not just sexual habits, but exercise behaviors, food patterns. This is where most of your habits are formed. So you do want to be concerned that this does not lead to health problems as an adult. It is easier to address these when the child is an adolescent, particularly when it comes to weight control or activity level. Intellectually, they're starting to develop their own values, so they may not have the same values as their parents. However, on the other side, they don't always see the consequences of their behaviors, so this is something that parents and healthcare providers should focus on, is making sure that they understand the consequences of choosing certain behaviors. Emotionally, there's a lot of peer pressure, so this can lead from anything to anxiety, to depression, to angry outbursts, and that is fairly normal. There is a lot of pressure to behave exactly like the rest of your friends, and so this can create a wide range of emotions in our teenagers or adolescents. Socially, friendships are going to be more important than family relationships, and this is also the time where we start to see an increase in things like eating disorders, substance abuse problems, STIs, suicide, higher rates of violence. So you should definitely be screening inside the office in some way any risk factors for these things as part of your history taking. For care, especially since most of their activity comes around friendships and sexual activity, they should be aware of the consequences of sexual activity and what they need to do to lessen those consequences. They need someone to listen to them and then to give them real facts. Oftentimes their friends do not have the correct facts, so make sure that if they have questions that they're getting the proper information. They need to be able to feel like there's somebody they can trust. They need somebody to provide discipline and to be consistent. They should start to be learning how to be independent at home, so learning to cook and clean, do laundry, for example. And they will take after people who set examples, whether that's good or bad. So, of course, the recommendation is to set a good example here for our team.